let's discuss another set of useful sentences for OET speaking. 4. Aged care services. Most takeaway food contains high levels of sugar, salt and fat. They are not healthy food. They will increase your blood fat levels. I suggest you to cook more healthy food. If you really don't like cooking, I could arrange Meals on Wheels for you. They offer healthy food. Healthy food is those full of fibers, like wholemeal bread, fruits and vegetables, especially green ones. I understand your worries. I will give you some help. For example, Meals on Wheels. They offer 3 meals so that you don't have to cook by yourself. And I will assign a carer to help with housework, such as dressing, bathing, washing, cleaning, gardening, and things like that. How does that sound? The carer also can do shopping for you and chat with you. I will give you the numbers of those support services. If you need anything else once you have been discharged, you can put services in place. These services also can help you a lot and you will have more time to rest. Remember, you need rest for full recovery. 5. Epilepsy. Epilepsy is a condition in which a person has spontaneously recurrent seizures. And seizure is a symptom of excessive neuronal activity in brain. Seizures are often associated with a sudden and involuntary contraction of muscles and loss of consciousness. Some conditions could trigger seizures, like excessive alcohol intake, overtiredness or poor quality of sleep. However, don't worry if you take the medication regularly, have an 8-hour sleep every night, eat regular meals and do not make yourself too tired. Your headaches and blackouts would be controlled effectively. The medications enable you to lead a normal life. If there have been no seizures for at least 4 years, you would not need the medication anymore. But before stopping the medication, you will need a checkup by your doctor. Epilepsy does not impact on your traveling. But I suggest you to wear a medical alert bracelet or identification card. Generally, it is usual to continue medication until there have been no seizures for at least 4 years. But it depends on individuals. It is probable a lifelong course of medication. However, the medication is safe for long-term use. It has been used in clinic for many years. Many people in your situation have taken this medication. Exercise. Exercise is very important. Even a small amount of exercise every day will benefit you. Exercise would reduce blood fat, make your blood pressure in good levels, and make your muscles stronger, including the muscles in your blood vessel walls. You could walk around your house for 5 to 10 minutes every day. I would refer you to a physical therapist, who will design a special exercise plan according to your situation and give you special instructions.